Early on, we didn't have enough access to N95s.
We had a significant outbreak before we even knew what hit us.
There was really this double pandemic of both racism and COVID.
As I say, the pandemic did not cause disparities, it unmasked them.
The pandemic forced us to think outside the box a bit.
We had to extend our food delivery service, our food pantry services to a couple of times a month as opposed to just once a month.
We were very creative. We created a lot of new partnerships, a lot of new relationships. We cannot accept being unable to provide a service to our community because of masks or swabs or something that's in short supply.
It is bad.
We have to come together.
It is horrible.
We will get through this together.
It is scary.
I know we will beat this.
But there is still good.
You know, philanthropy needs to really take very much sort of a silent partner approach to that. We need to be behind these organizations and communities, resourcing them, and not assume that we should be sort of at the front of the effort, because it is those leaders and those organizations that are really going to carry the day and are going to be most trusted.
Our essential workers weren't being treated right. I mean, it was just awful. And I just hope we're able to continue to build upon this and make sure that the organizations that we're working with now have the infrastructure and the capacity and the direction and the help to get federal funds and state funds, because they certainly have a head start, I think, in this space. And I'm working each and every day to make sure that the funding opportunities are there for them to access.
So this project has really been about saving lives, if nothing else. And the community-based organizations that we've identified in the rural areas and in urban areas or highly concentrated minority areas have been a beneficiary of this partnership. And we just look forward to what the next steps are. As you know, we've had to pivot to many different things. We started with the project of how do we just address this pandemic? And then we had to pivot, now we have a vaccine to address this issue. And so, you know, getting the community confident with the vaccine and the messages that they're receiving has been fun. It's been a challenge. The partnership has been great because everybody was committed to really just saving lives.